Hello, my name is Heather Raley and I work for Mosaic Group, who partnered with Johns Hopkins to integrate the pediatric SBIRT program to Howard County General Hospital. I'm going to give a quick overview for nursing staff on the SBIRT program in the pediatric department. So at the conclusion today, you will aim to understand the evidence-based pediatric SBIRT program, understand the role that nurses play within the SBIRT program, and screening for risky alcohol and substance use. So SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. Howard County General does recognize the need for more powerful response to and support to adolescents who use substances. So the pediatric SBIRT program includes universal screening, meaning every patient ages 12 to 17 who comes in to the pediatric emergency department will be asked the same set of questions. A peer recovery coach or behavioral health navigator intervention, we'll discuss what that means. Harm reduction tools, and warm handoffs to or referrals to substance use treatment and other recovery resources. So how is it implemented at your hospital? The intervention model includes integrating peer recovery coaches. We'll explain their role in a second, but they are people in long-term recovery themselves, or behavioral health navigators who are current staff at the hospital working with patients with mental health or substance use concerns, and social work staff in the pediatric department to deliver brief interventions and make referrals to treatment. So the first step includes all pediatric patients being screened who are 12 and older. The medical team or EPIC alerts the peer recovery coach or behavioral health navigator. There's an automatic alert within EPIC if a patient does screen positive for the behavioral health navigator or peer recovery coach to see the patient. We'll review that in 1 second as well. A healthcare professional reviews this screening scores and medical history and the reason for visit, and then delivers a brief intervention, which is a short discussion on substance use and what are the goals and interests of the patient. And then the healthcare professional will work with the patient to develop a plan, scheduling any necessary appointments. So what is this SBIRT screening? So what's utilized at your hospital is the CRAFT 2.1, and this is a well-tested, validated tool for patients ages 12 through 21, but for your purposes, obviously patients only go up to age 17 in the pediatric emergency department. And so you'll screen patients ages 12 to 17 using this validated tool used to assess alcohol and substance use risk. It is divided into 2 sections. Section A will always be asked. The second section will only be asked if necessary. There's also exclusion criteria, and these are for patients who cannot be screened for one reason or another at the current time. So every patient ages 12 to 17 should be screened. The questions should be asked exactly as worded. We encourage you not to take a shortcut, not to ask just general questions like, do you drink, do you smoke, do you vape, do you do any drugs like marijuana, but instead ask the questions exactly as worded for every patient that comes in. The screen can be found in triage activity. So what is the exclusion criteria? So there are sometimes when a patient is unable to be screened. The documentation must always occur on the CRAFT screen, whether they can be screened or not. If they cannot be, you utilize this exclusion criteria. And this is used when screening is unable to be conducted for one reason or another, such as acute psychiatric illness, they're critically ill, and so on. If a patient is intoxicated, even if they are able to answer questions appropriately, but they're appearing pretty intoxicated, you can just select intoxicated, and this will trigger to the peer recovery coach or behavioral health navigator to see the patient. Similarly, at the bottom, you see suspected opioid overdose or suspected overdose non-opioid. Both of those items will also trigger to the peer recovery coach and behavioral health navigator, so they'll know that this is a patient to reach out to. Finally, this provider request means that maybe the patient didn't get a screen or their screen does not appear to be accurate, but the nurse, the provider, some other staff still wants a peer recovery coach or a behavioral health navigator to see the patient. So this will alert the patient as well. However, if they are nonverbal, if the patient refused, they're critically ill, or experiencing acute psychiatric illness and unable to answer, you would select one of those options and it would not trigger the peer recovery coach. So the CRAFT 2.1, like I mentioned, has 2 sections. The top section is always to be completed, and we're looking for any use of the following substances within the last 12 months. A drink more than a few sips of alcohol, using anything else to get high like marijuana, or using marijuana or synthetic marijuana, or vaping THC oil. We encourage you to try to get a good sense of how many days in the last 12 months they did use the substances. But if you need to give a rough estimate, that's okay too. If the patient says pretty much every day, you can ask about how many days a week they skip or a month that they skip and give a good estimate. But I wouldn't get too hung up on this specific number of days, but instead having a good sense of, is it most days in a week, most days in a month, most days throughout the last year, or has it been a very rare and sporadic use, and giving that the best estimate of the number within the box. Any answer of a 1 or above in any of the boxes will trigger Part B, but if a patient denies using any alcohol, any types of marijuana, or anything else to get high, then you do not have to do Part B. Part B is where the craft name comes from. So the C is in the first question, car, the R is in the second question, relax, and so on. The craft can score from a range of 0 through 6. This predicted probability of substance use dependence at the bottom calculates on its own. Don't pay too much attention to that. Any yeses will be triggered as a positive screen to the peer recovery coach. So this can score from a 0 through 6. Any scores of 1 or above will be considered a positive screen. So in summary, universal screening, every patient 12 and above gets screened. What is a positive result? Scoring a 1 or greater on the CRAFT 2.1 screen, or an answer of the following in the exclusion criteria: intoxication, either suspected overdose, and a provider request. The BI in SBIRT, a brief intervention, is to be completed by the peer recovery coach or behavior health navigator. And so again, there is an automatic reminder or trigger to the peer recovery coach behavior health navigator. This patient who's screened positive will automatically populate on their board. Feel free to reach out to them if you would like to, but it is not necessary. You complete the screening whether or not a peer recovery coach or behavior health navigator is on shift, because if they aren't on shift, they will reach out to that patient within a day or two to try to talk to the patient by phone, or if they're still in the hospital, they'll see them in person. A brief intervention is a motivational conversation focused on increasing insight and awareness regarding alcohol and substance use. And so they're going to be talking with the adolescent patient about how their use is affecting their life. Is it interfering in their life at all? What changes might they be willing to make? If they're not interested in making changes, that's okay too. Peer recovery coach or behavior health navigator will be supporting them in whatever way the patient is willing to accept support. The peer recovery coach, behavior health navigator will ask for privacy from the guardian. They will follow the patient's request. If the patient is okay and allows the guardian to stay, they will interact with them to the degree which they're comfortable, but they will attempt to discuss with the patient first without the guardian in the room. And they'll aim to see a patient within 1 hour of a positive screen if on shift, and if not, we'll contact the missed patient on the next shift. And finally, harm reduction. And so something that may or may not be new to you is something that is been longstanding in most adult emergency departments and relatively new to adolescent emergency departments. Narcan is an opiate overdose reversal agent. This immediately reverses the effects of Narcan. Any patients using illicit substances from the street, specifically opioids from the street, should leave with this kit. This is a medication in the kit. It's a 2-pack, 4 milligrams each, that they can leave with from the hospital, either the emergency department or the inpatient unit. Any patient with a history of illicit opiate use, such as any pain medications, heroin, fentanyl, etc., should leave with a Narcan kit. The provider can place the order, and the nurse can give the kit to the patient or the parent prior to discharge. Thank you for listening to your training. There will be a few questions to answer following this. If you have any questions at all, please be sure to see your charge nurse on shift or your unit director. Thank you.